Uh, just to recap, we've covered thigh wraps and ankle wraps, and as far as other injuries go in tennis, we have tennis elbow. Now there are tennis elbow wraps. We will not have those available, but they may have them. They've brought them with them from that they purchased at a drugstore. Um, as far as tennis elbow injuries, if you think that they're swollen and too painful to go on, you're going to have to advise them that they need to see somebody to get this treated or treated with anti-inflammatories. And of course, the initial RICE application is important, using ice and rest it, elevate it, and you can't put an elbow wrap around them if they're acutely painful. Just put a wrap such as we have done for the ankle. They're pretty simple to wrap. And if anything, any other injuries such as stress fractures, if you feel that they've got a stress fracture of the foot, the toe, again, you're going to have to advise them to go and get this x-rayed. Now, as far as other injuries go, some of them are going to be unusual, such as head injuries, and say somebody had a heart attack or other problem. You're going to have to deal with them as you normally would do in the urgent care, and probably refer them on to a facility to have them dealt with and assessed. The next topic that I'd like to discuss is probably one of the most important in our, especially at this time of year, and in this region, is heat-related illness. The heat here can be unbearable, and I'm not sure what the weather is this weekend, but at present we're in the 90s, and so heat-related injuries will be uppermost on our minds. And this is a very insidious problem, and it can gallop along very rapidly if you're not acutely aware of the early signs. So, and there are various stages that they classify heat-related illness into, but basically it's based on severity, and you want to recognize early that this person is getting into trouble. And the first stepping stone in anything in sports is prevention, and so fluid intake is of primary importance, and them getting in the shade is equally important. Just be out in the sun for longer than 20 minutes in some of this heat, you're at risk. And of course, age makes a difference. If they're elderly, if they're children, they also are very prone to heat-related illness, and with very few warning signs. So heat-related illness, they divide up into heat cramps, and then it progresses to heat exhaustion, and then it progresses to heat stroke. And heat cramps basically are what the name implies. They get cramps usually in the thigh or in the calves, and they're related to not taking enough fluid and sweating a lot and losing sodium very quickly. Usually they're not in very good shape, and they can get cramps. Those are treated fairly simply. You massage the muscle, try to stretch it, and take on fluids. Sports drinks are useful in this particular situation. The next heat-related illness is heat exhaustion, and heat exhaustion refers to water depletion or sodium depletion, or you can have a mixture of both. And heat exhaustion, you've got to understand that it can occur whether they're taking enough fluid or not taking enough fluid. Sometimes they're taking too much fluid, but it's the wrong kind of fluid. If you're just taking water, you can get actually too much. You're still depleting your salt, and that leads to the symptoms of heat exhaustion. And basically, this heat exhaustion, or everything that you get with heat cramps, but you also get more. You can have vomiting. You can have you get tired, confused. That can occur with heat exhaustion. So if somebody's dizzy, confused, throwing up, they probably have heat exhaustion. Heat stroke is a progression of all of those, and you add on that their temperature is over 104 and over 40 degrees centigrade, and that they can seizure, they're very ill with heat stroke. You see that situation is the 911 situation. The heat exhaustion is the in-between. That's where you have to make the judgment. Are you going to send this person to the emergency room? Or are you going to try and put them in the shade, give them lots of fluid, maybe get ice under their armpits, ice in their groin, and see if you can get their temperature down. Their temperature may be up, as I said, it can be up to 104, but I think if I saw somebody that had a temperature of 103, I'd probably be sending them to the emergency room too. They're usually fairly sick if they've got a temperature like that. So you want to be monitoring their vitals, you want to be giving them fluid, and you want to be monitoring them. Are they confused? Are they able to converse normally with you? If they're not making sense, if they've got somebody with them and they're not making sense to them, those people need to go to the emergency room to be assessed. Just to conclude, we've made up a brochure that you can refer to that covers some of these common tennis problems and some of the illnesses that are related to it, and you can give that to the patients, and also it's something that you can refer to when you're on site just to guide you or to give you an idea how you're going to handle things. Thank you.